This is the Cancer Interviews podcast, and I'm your host, Bruce Morton. For our guest, it wasn't enough that she learned she had HER2-positive breast cancer. Not long after that, Beth Brubaker of Alexandria, Kentucky, found out she was pregnant. As it turned out, Beth stood up to both and went on to tell her story in a book. But right now, she's going to share her story with us. So here she is, and Beth, welcome to Cancer Interviews.
Thank you so much for the privilege to be here.
Beth, we want to start out the way we always start out at our interviews, and that's to learn a little bit more about you. You do have a life exclusive of cancer. So if you would, tell us a bit about where you're from and what you do for work and what you like to do for fun.
So I am from Alexandria, Kentucky, which is 15 miles south of Cincinnati. I grew up in Cincinnati too. And I am a high school English and journalism teacher in one of the river cities in northern Kentucky. And what do I like to do for fun? Well, I have a almost 5-year-old daughter, so she keeps my husband and I incredibly busy. But I also am an avid reader, and I just love spending time with my family.
Now, there was a time in your life in which your health was good and everything seemed normal, and then something happened that sort of upset the apple cart and led you to believe something was wrong. And once you investigated that, it led to a diagnosis of cancer. So if you would walk us down that road of your initially discovering something was wrong and how that led to your diagnosis.
So I noticed that I had an ulcerated sore on my left nipple, which is, I thought maybe I had cut myself several months before even thinking it was anything. But the problem was that ulceration did not heal. And so, of course, I went to Dr. Google, and everything that came up for that was cancer. So I let it go another month or so and noticed that there was bleeding from that ulceration on my left nipple, and decided that it was in my best interest to call my OBGYN. From there, fortunately, my OBGYN took my concerns pretty seriously. She knew that my grandmothers were both 2-time breast cancer survivors. I had gone through genetic testing and had tested negative. So everything was pointing to the fact that this wasn't anything to worry about. But instead, she listened to my concerns and she said, I just want to make sure. So she sent me for a diagnostic mammogram. And I remember it was September of 2018. I went for that mammogram, and fortunately, the radiologist said, I see what we call calcifications. And so 70% of the time, this is nothing. But I would like to send you for an ultrasound-guided needle biopsy in that area. So the radiologist sent that to me, still with this idea that this was probably nothing to worry about. And then on September 26, 2018, I sat in a conference room at the local hospital, and it came back that I had stage 0 ductal carcinoma in situ, with a presentation of Paget's disease, which is breast cancer that has invaded the skin.
So what happened next?
So from there, I was referred to a breast surgeon here in northern Kentucky, a well-respected breast surgeon, and she said, well, we need to do a breast MRI. And so we need to do it as soon as possible. But she had also known from my medical records that we had said that there was a chance, we had been trying for a family, that I could be pregnant. And so she said I had to do a pregnancy test before this breast MRI. And I found out that I had breast cancer on September 26, 2018, which was a Wednesday. And I found out on September 30th, 2018, that I was pregnant with my daughter. And it was the biggest roller coaster of emotions you could ever imagine in that moment. It was awful. We had experienced a loss several months previously, so this was our first time really trying to get pregnant again.
By the way, we're confident you'll be able to learn some tips and tools to help you through your personal cancer journey. But first, we'd like to invite you to please give us a like, leave a comment or a review below, and share this story with your friends. Kindly click on the subscribe button below and click on the bell icon so you'll be notified the next time we release an interview. And if you or a loved one are facing a cancer diagnosis, please click on the link in the description and show notes below to check out our free guide, The Top 10 Things I Wish I Knew When I First Got Cancer. So, Beth, let's talk about when you first got cancer. There was that gap of a few days between your cancer diagnosis and learning that you were pregnant. So let's start with that. That's never an easy time for anybody. So we're not going to ask if it was a bad day. Of course it was a bad day, but there are all sorts of variables involved: the diagnosis, your persona, any other things around you. You take all those things together and put them into an equation. And what went through your mind after you got that diagnosis?
Unbelievable that two of these things could have happened at the same time. At the time, I was 31 years old, and young people aren't supposed to get breast cancer. I had done everything correct. I had gone through genetic testing because of my family history. I had been watching and doing self-breast exams. This was not supposed to happen to me, and that's all I could think of. But when you're diagnosed with cancer, you go into fight or flight, and we went into fight mode. We knew that we had this pregnancy on top of it, and that Wednesday, my breast surgeon was able to see me, and I will never forget, she sat me down, she held my hand, and she said, "We can do both of these things. You can be happy that you're going to have a baby. We are going to figure this out, and we can do this together." And even though I was absolutely terrified, I was scared I was not going to see this baby go to kindergarten. Those words really gave me at least a little bit of ease that we were going to get through this. And at that point, I was only 4 weeks pregnant.
Now, that sounds like it was a source of support, but how about your husband, Jason, and his source of support?
I have the most wonderful husband on the planet. I really do. And he always is a person that likes to attack things head on. And so that was the mode he went into as well. He said, "We are going to get through this." And we fortunately have incredible family support. So on September 26th, the day of my diagnosis, we sat on our porch, called our family, and the first thing they said was, "We will be, whatever happens, we are going to be there. We will be there for every surgery. We will make sure you are well taken care of." And you can't buy that kind of support from family. And fortunately, we also both have phenomenal coworkers my coworkers knew that I was doing additional testing they had been covering classes for me to make sure I got what I need. And I have the most phenomenal coworkers on the planet who also, I sent them an email that evening, and the response was, "You tell us what you need. We are going to take care of you." And so it's Jason, just his personality. He made sure that I had everything I needed in those first moments.
Beth, so it sounds like you had great support from Jason, from your extended family. You got words of encouragement from the doctor who's spearheading your care team. But here you are having to deal with these two things at the same time. I'm sure you have many friends who have had babies. And by now, you've had friends who have experienced cancer, breast cancer. But I don't think there's probably a lot of people you know who had to deal with both at once. So how could you and Jason get your head around this notion of two things in which just one of them would demand your full attention, but now you had to apply that attention to two things, and you had no experience to go on and very little in the way of outside knowledge in terms of how to deal with this?
So I will tell you, throughout my pregnancy, it took probably until I was in my second trimester, which was December of 2018. that I actually felt at ease about this pregnancy, given that we had had a loss beforehand. Our focus at the beginning was my health and making sure that I was safe. And fortunately, that was one of the questions that I did ask my breast surgeon at the start, was if she had had experience with pregnant cancer patients. She said it had been about 2 years, but she did. And so that also brought us at least a little bit of peace of mind that this was possible to handle both of these things.
Now, I want to talk about the two tasks that you had to address. I want to talk about them separately. So I want to set off to one side the pregnancy and talk about your cancer journey. If you would, tell us about the treatment regimen that you and your doctor agreed upon. Tell us about that.
So I was diagnosed clinically with stage 0 ductal carcinoma in situ, which means that the cancer itself, the cells were contained within the breast ducts, the ducts in the breast. And so initially my treatment plan was going to be a lumpectomy in the left breast. And that's what they call breast preserving surgery. And so it's able to preserve the breast itself and just take the cancer out. I would lose the ability to breastfeed on that side, but it would still preserve most of the breast tissue. And then the other part of that would be radiation after the baby was born. So on November 2nd of 2018, we did that lumpectomy, but my breast surgeon at least, was still considering that ulceration. It still had not looked any better. And we're talking, my diagnosis date was September 26th of 2018. And now surgery was November 2nd. We're talking 6 weeks and there was still really no change. And so she wanted to biopsy it just to see what that would look like. And that is when everything changed. And so she biopsied it and saw that it was actually HER2 positive invasive ductal carcinoma presenting as Paget's disease. So it's that invasion of the skin. And when you have HER2 positive breast cancer, they don't do any kind of oncotype for that. It is, you are going to have chemotherapy regardless. And so because of where I was in my pregnancy, I would have to you can't have chemotherapy until the second trimester. And so they were going to need to do a mastectomy immediately to get rid of the cancer in that left breast. And so that lumpectomy changed everything. So
you did not go on chemotherapy right away because you had to wait for the onset of the second trimester. So during that interim, by way of medication, what were you taking?
Nothing, actually. Nothing. They did the mastectomy on December 14th of 2018. I was 14 and a half weeks pregnant, and I had already met with my oncologist, who is well known in Northern Kentucky, phenomenal. And she actually, and I truly believe in a higher power, and she had actually worked with pregnant patients with cancer at the Cleveland Clinic during her fellowship. And so she had experience. We felt very comfortable with her. So she wanted to give me some time to heal. So that's why there was a gap between that 14 and a half weeks having surgery. And then I started chemotherapy on January 2nd of 2019 at 20 and a half weeks pregnant. So right in the thick of that second trimester.
Now, if you would talk about the chemotherapy phase, as we're still on your cancer journey, more so than the pregnancy, but what sort of medication did you take with the onset of the chemotherapy regimen? So
it's amazing to me to this day that there are types of chemotherapy that are filtered through the placenta and that are safe in pregnancy. And so 2 of those drugs that have been well studied with pregnancy and cancer are Adriamycin, which is also known as the Red Devil. It's one of the harshest chemotherapy regimens you can have. And then Cytoxin. And so what I did is I did 4 rounds of Adriamycin and Cytoxin as a combo. Typically that's given every 2 weeks. But my oncologist felt very comfortable spreading it out 3 weeks. So that way I wouldn't have to have what they call Neulasta, which is an injection in your arm that is supposed to boost your white blood cell count. And so she said, if we wait an extra week between cycles, she said, I think your body will rebound itself. And she was 100% correct. I did not have any problems during chemotherapy, very few side effects, typically nausea, vomiting, none, 0. And a large part of that, she believes, is because of being pregnant, that the female body does amazing things trying to protect the baby. And so after those 4 rounds of chemotherapy, I would need an additional 12 rounds of what they call Taxol, which is usually given weekly. So I had 2 rounds of Taxol and then had a month off. And then Harper was born on May 21st, 2019.
Now, it sounds like the chemotherapy regimen that you described is not as grueling as it is with other people, but still it's chemotherapy, and it can affect your energy level. It can affect the way that you taste food. Meanwhile, you still need to devote the energy you need to devote to your pregnancy. If you would, Beth, talk about at this juncture, we've asked this question before, but I'm asking it a second time. I might even ask it a third time, because there are different stages of this journey in which you have these 2 very important tasks going on at the same time. So when you're going through chemotherapy, even if it wasn't as bad as it is for other people, it's still chemotherapy, and you're still carrying a child. If you would, at that stage, talk about how you juggled the 2 of them and what challenge that presented.
It was very challenging, because not only was I going through chemotherapy, which the day after chemotherapy, this regimen, I worked normally, I felt fine. And then it was the day after. So I had chemotherapy on a Thursday. I would work that Friday, and then Saturday and Sunday, I would be in bed all day, would not get out of bed because of the exhaustion. That was one symptom, side effect from the chemotherapy that hit me hard, which I also think went in tandem with also being pregnant as well. So that was very challenging. But I was really committed to working as normally as possible as a teacher. It's something that I'm incredibly passionate about. And so I think having that normalcy was really important. So I was juggling doctor's appointments for chemotherapy, and also I was in the high-risk clinic for my pregnancy. So I had a nurse that worked specifically with me outside of the OBGYN group as well. I would have additional screening. They were checking baby's heart rate towards the end and just making sure everything was smooth. So I'm of the belief that you do what you have to do. So juggling all those things, I did it because I had to do it in the moment, and we were trying to retain some sort of normalcy prior to Harper being born.
So you already had, and I don't mean to make light of this, you already had sort of a 2-ring circus with a chemotherapy regimen and carrying a child. And now here you are teaching school, and we know that you're teaching kids, and kids can get unruly. How difficult was managing the stress of that with everything else that was going on?
I will tell you, and I still am in touch with students from that time who have since graduated. I truly believe each of those students that I had 5 classes were handpicked for me to have that year. They were wonderful. My school district made sure that my kids were sanitizing between classes. They were coming and like making sure that they had freshly washed their hands in order to keep me healthy. And my students that year were incredible. They were absolutely incredible. They made sure that I had as normal of a school year as possible, given light of everything else. And to this day, I'm still incredibly grateful. And it has been 5 years.
Now, your chemotherapy regimen, it didn't go on forever. Eventually, it came to a conclusion. And I'm hoping that right around that time, that for you, with respect to the cancer journey, things were getting better. Is that fair to say that not long after the chemotherapy was done, you could see some metaphoric light at the end of the tunnel?
Yes. So after Harper was born, I still needed to finish my chemotherapy regimen. So I went through 10 additional rounds of weekly Taxol. And they also started two drugs that are very specific to HER2-positive breast cancer that basically had changed what HER2-positive breast cancer is in the community. It used to be that was almost a death sentence. And then came Herceptin and Perjeta, which are targeted treatments that go with chemotherapy. And they had to wait to start them because they are not safe in pregnancy. So I started them the week after Harper was born, which was May 30th of 2019. And I finished chemotherapy and continued doing Herceptin and Perjeta for another several months. But I will say August 1st of 2019 is in my top 5 greatest days of my life, because that was the last time I had to have weekly Taxol and any sort of chemotherapy, and we celebrated big. And that date is very significant to us as well, because that was the date that my oncologist got to hold my daughter for the first time. And she had worked so hard to keep Harper safe that it was just, talk about a light at the end of the tunnel. It was the biggest celebration you could ask for.
Beth, by now, I'm sure people listening to this, watching this, especially the women who are watching and listening, they've heard us mention Harper every now and again, but I think that they want to know, how did the childbirth go? Did that go well?
It did. I mean, minus breast cancer, my pregnancy was pretty average. Everything went well. She was healthy the entire time. The only thing that Harper was when she was born, and I was induced at 37 weeks. She was a term baby. The only thing was she was small, and they said that can be common with babies that are exposed to chemotherapy. But she was 5 pounds, 4 ounces at 37 weeks, which is small. But she otherwise cried and screamed and came screaming into the world like what you would consider a typical baby. I did not. I had a typical vaginal delivery, no C-section. And yeah, unremarkable pregnancy if the cancer journey wasn't part of that.
So there was a successful childbirth.
Yes.
And you've gotten past breast cancer. Just, yes. I don't know if triumphant is the right word to attach to this. If it isn't, you can substitute a word that is right. But just how did that feel to successfully bring Harper into the world and get past your cancer journey, or at least the worst part of it?
Oh, gosh. You're worried for 9 months that people can tell you all the time that the baby is going to be fine. And then you see this baby actually is fine. I don't think gratitude, there's a strong enough word beyond, I don't think gratitude is strong enough, and truly thankful to God. I don't think those words are strong enough for that moment in our lives.
Now, a phase of this that we brought up very briefly at the top, but now we want to get into it in a bit more detail, is that you have chronicled your journey with cancer, with pregnancy, in a book. If you would, tell us about the book.
So the name of our book is 25 Months. I wrote it with my husband, and we wrote it, you get to see our sides alternate. So you get my perspective and my husband Jason's perspective. And we named it 25 Months because that for us is really where our journey began. And that was with our miscarriage prior to becoming pregnant with Harper. And so in the span of 25 months, we suffered a miscarriage. We went through cancer while pregnant. We went through some other trials with the health of our now 5-year-old nephew, and then COVID. And so it spans from April of 2018 to May 21st of 2020, which May 21st is my daughter's birthday. And that was also the same day that I had, so a year later on May 21st of 2020, I had my final Herceptin and Perjeta treatment, my final cancer medication ever. And so very, very special time for us. So that is what the book details. And we wrote the book really to start, have something written down for Harper is what it started with. And then it evolved from there once we realized that there's not a whole lot out there for young breast cancer patients. And there's even less out there given the perspective of a cancer caregiver, because we truly believe that cancer is a family diagnosis.
And I think, Beth, that just as people wanted to know how childbirth went, Harper, as we speak, is 5 years old, and you said she might have been born a bit small, but from a health perspective, how is she doing these days?
Oh, she's awesome. Right now, she's actually upstairs playing. Yeah, she will be 5 on May 21st of this year, and she is going to kindergarten next year, and she is incredibly smart, funny, witty, creative. And if you met her on the street, just met her, you would have no idea what that child went through to get here. And so she is thriving. And I just very, very grateful to be here to see that.
Beth, just one other thing about the book, and then we're going to wrap up with the same question we always wrap up with. But if somebody wants to get hold of 25 Months, how can they do it?
So we are on Amazon, and there will be a link in this, and we're on Amazon. And then also I want to mention that 10% of the profits from 25 Months will go back to the Harper J. Brubaker Living Fund through an organization called the Karen Wellington Foundation for Living with Breast Cancer. The Karen Wellington Foundation is based here in Cincinnati and is named for a woman named Karen Wellington, and who lived with breast cancer for 10 years and then finally passed away. But her goal was, when she beat cancer, she wanted to gift a vacation to another family. And so her husband, Kent, started the organization here in Cincinnati, and they are on track to give 1,000 gifts this year. And those gifts are what we call gifts of fun, which is very much an unmet need. There are other organizations that give meals or give funds for treatment, but there is nothing like putting fun back on a woman's calendar. I had 23 days after finishing chemotherapy, I had a spa day through the foundation, and it gave me some dignity back. So the Harper J. Brubaker Living Fund targets women who are living with breast cancer who also have children under the age of 5. And so we have been able to gift since 2021 to vacations, spa days, zoo passes. So 10% of the proceeds from 25 Months is going back to the foundation. And to date, we've been able to give now, just from the book, almost $300. So
that's outstanding, Beth. And we're going to wrap up now. We always wrap up the same way. Our guest is Beth Brubaker of Alexandria, Kentucky. And Beth, Quite obviously, a lot of women out there who sadly have been diagnosed with breast cancer, and even more women out there who've been pregnant, but it's a very narrow profile of women who are experiencing both at the same time. If you were to meet somebody one-on-one who found themselves in the same position that you were in, if there's one overarching bit of advice you would want to share with this woman, what would it be?
I would say find the best medical team that you can. Do not be afraid to ask questions. And also just know that there is a life after cancer, and there is a light at the end of the tunnel, and cancer is not forever.
Excellent. Beth, thank you so much for sharing this story. It's going to be of inspiration to a lot of women who hear it. And you mentioned that cancer is a family thing, so it's inspiration also to their families too. So Beth Brubaker, thanks very much for sharing your story. Thanks for being with us on Cancer Interviews.
Thank you so much for the opportunity.
And that'll wrap up this episode. As we remind you with each episode when we conclude, if you or a loved one are on a cancer journey, you are not alone. There are people out there like Beth, who have information that can inform and inspire. So until next time, we'll see you on down the road.